Hello, good afternoon, everybody, and welcome to today's virtual lunch meeting. My name's Sam Ciotkowski, and I'm the Sales and Marketing Manager here at the JCN. I'm just going to run through a couple of bits of housekeeping before we get started with today's session. So today's session is titled Clean and Kill Infection with UrgoClean Ag. And our speaker today is Ben Harrison, who's a Urgo product specialist. Welcome, Ben.
Thank you. Welcome.
And today's session is sponsored by Urgo. So a big thank you to them, big thank you to Ben, and big thank you all to you for joining us today. We will be posting certificates for your CPD revalidation at the end of the session, so you'll see a link in the comments section for that. And we'll also have a live Q&A at the end of today's session as well. So any questions that you might have for Ben, please do post them in the comments. One of my team will be answering any other questions and technical questions in the comments as well, and posting all links for you too. Do bear with us if there are any technical issues. Again, the team in the comment section will keep you updated if there are any, but I'm sure there won't be. So enjoy the session. I will see you at the end for the live Q&A, and I'll pass you now over to Ben. Thank you.
Thanks so much, Sam. Well, good afternoon, everybody, and welcome. It's a real pleasure to be here today. And this afternoon, we're going to have a look at the impact of wound infection to the healthcare system, and also to the patients who suffer from wound infections, and why the early infection recognition and intervention are really of vital importance. And we'll explore the four main enemies of an infected wound that all need addressing. We're going to have a look at a dressing called UrgoClean Ag as well, and look at how it can help you effectively fight each of these four enemies that we're going to look at and get your patients back to living their lives, while also at the same time being kind and delicate to the patient's surrounding skin and to the wound upon removal. We will then show you how effective UrgoClean Ag is on a range of key criteria that's backed up by a large amount of evidence, and how we outperform other silver dressings in a major observational study of real-life clinical practice. So let me ask, how do wound infections affect your patients and also you as a healthcare professional? Well, we all know that infection can be one of the most common complications of non-healing wounds. Wound infections affect nearly 50% of patients suffering from a diabetic foot ulcer, 50%, and nearly 10% of all leg ulcer patients. In addition, wound infection can impact the mental well-being of the patient, of course, we know, and can cause anxiety, confusion, and stress. Prolonged or recurring wound infections can increase the workload, of course, of the NHS staff and really be emotionally draining for everybody concerned. And also, it's important to remember that left untreated, wound infections can be limb-threatening and potentially life-threatening. So it's important to spot the presence of infection as soon as possible and to initiate an effective wound infection treatment right from day one. So let's look at the enemies that we need to fight when tackling wound infection. Now, some signs to look for if you suspect a wound infection are unpleasant smell coming from the wound, redness around the wound, what we call erythema, which is potentially spreading, a wound which is more painful than usual, a change or an increase in the wound exudate, or any bleeding that wasn't there before, the presence of large amounts of slough. However, unfortunately, spotting wound infection isn't always straightforward, as there are signs and barriers such as biofilms, debris, and microbes, which can sometimes be well hidden below the surface of the wound. And these can limit the effectiveness of an antimicrobial dressing and can further delay wound healing and potentially, if not removed, trigger the recurrence of a wound infection. So to effectively fight against local infection and minimize the chance of recurrence, both the visible and the hidden barriers need to be removed. And these four enemies are exudate, which can decrease wound healing by sustaining biofilm, slough, which favors microbial proliferation, biofilm itself, which can limit the action of silver dressings, and obviously the microbes which delay healing. So now, having discussed the 4 key enemies that are both visible and hidden in an infected wound, we now want to immediately demonstrate that UrgoClean Ag addresses all of them. Now, UrgoClean Ag is a dressing which can fight both the visible and the hidden barriers in an infected wound. UrgoClean Ag is able to completely and continuously clean the wound from any slough and exudate present. The polyabsorbent fibers of UrgoClean Ag deliver a complete and continuous cleaning action which removes slough and exudate. We know that biofilms have also been recognized as a hidden barrier to healing, so it's important that an antimicrobial dressing is able to destroy them and remove any biofilms present in the wound. UrgoClean Ag has the complete cleaning action as well to remove biofilms and to prevent their reattachment. An UrgoClean Ag is a dressing with a broad spectrum antimicrobial as well, and it starts working right from the word go. The special TLC-Ag complex of UrgoClean Ag starts working as soon as the dressing is applied to the wound and carries on working for up to 7 days. We now begin delving into the different areas of cleaning, anti-biofilm and antimicrobial action in more detail. So let's start with cleaning. Let's have a look at a short animation of how the UrgoClean Ag works to clean the wound. What you saw in that animation was the polyabsorbent fibers of UrgoClean Ag gelling and swelling in contact with the wound bed and removing the slough, exudates, and microbes that were on the wound bed. So let's have a look at a real-life example of how UrgoClean Ag effectively cleans a wound. Before we do, let's just remind ourselves that the evidence shows that with UrgoClean Ag, you see a 75% reduction in patients with heavy exudate, a 62.5% reduction of sloughy tissue and wound debris. UrgoClean Ag is able to remove all signs of local infection, and as I said just now, you have continuous cleaning action for up to 7 days. So let's have a look at this patient here. Here you can see a patient with a really sloughy, wet, infected leg ulcer, quite substantial leg ulcer. I wonder how long you'd expect a dressing to clean the wound to what you can see on the far right-hand picture here. On the right-hand picture, you can see a nice, healthy wound bed that's being cleaned, and you can see some healthy skin in between as well. Well, UrgoClean Ag achieved this in just 3 days, 1 dressing change, which I think is a really remarkable result. You can see in the middle picture how the UrgoClean Ag has gently removed all that slough and debris and produced that really lovely looking clean, healthy wound bed in just 3 days. And you can see in the middle, there's a little thin ribbon of healthy skin in between. That's been protected throughout because we want that skin there. Because of course, from that, you're going to get some epithelial tissue migrating as well. So UrgoClean Ag has cleaned the wound, prepared it, and protected that delicate skin in the middle. Now, the Earth study, which is a large randomized controlled trial, so a high-level piece of evidence, demonstrated a significant reduction in slough compared to the gelling fibers of a CMC dressing. That's a carboxymethylcellulose dressing. The polyabsorbent fibers from UrgoClean Ag achieved a greater reduction in sloughy tissue, 65% reduction, compared to the gelling fibers from the CMC dressing. That was a 43% reduction over a 6-week period. So this is significant when it comes to cleaning a wound bed and preparing a chronic wound for healing. Let's now have a look at what a biofilm is and how a biofilm affects wound healing in an infected wound. So in recent years, biofilms have been identified as a barrier to wound healing and a factor whose presence can really limit the effectiveness of an antimicrobial dressing. To fully understand how biofilm can block the action of an antimicrobial dressing, we first need to have a look at their structure and the way that they function. So biofilms are attached communities of microbes protected by a strong slimy barrier, a polysaccharide sac. And the function of the barrier is to protect the microbes from any foreign intruders, and that includes antimicrobial agents. It's important to note that biofilms are not visible to the naked eye, but they do exist in more than 80% infected wounds. So most infected wounds, in other words, have a biofilm on them. And even when disrupted mechanically, they can reappear in just 24 hours. So if you're disrupting the biofilm mechanically when you're washing the patient's wound or preparing it, it's going to reform in 24 hours. So the first step when fighting against biofilms is to break the protective barrier, as this will allow you to get into the biofilm bubble and destroy the microbes that reside within. So an effective treatment against the biofilm will be a combination of a cleaning action, which can break the biofilm barrier, and a strong antimicrobial agent like silver, which will destroy the microbes that are within the biofilm bubble. Let's have a look at a little animation of that in action. So again, there you can see the polyabsorbent fibers of UrgoClean Ag. When they come into contact with the wound, they gel, they swell, and they bind on to the biofilm and lift it off, enabling the silver ions to kill the microbes. So let's have a look at some of the clinical evidence for UrgoClean Ag's ability to remove biofilm. Well, in just 24 hours, UrgoClean Ag has been shown to be 50 times more effective than a gelling CMC dressing on MRSA mature biofilm and 100 times stronger on Pseudomonas mature biofilm. Again, this is significant as it means that UrgoClean Ag means that you'll see quicker results and you'll get the wound back to healing sooner and your patients back to living their lives again sooner as well. We now come to look at the efficacy of the silver part of the UrgoClean Ag. UrgoClean Ag is a well-established product and has been successfully used across the UK for a number of years, delivering great clinical results. It's been tested and shown to be effective against a broad spectrum of microbes, including those resistant to antibiotic treatment. UrgoClean Ag is safe to use on any locally infected wound or wounds that are at risk of infection. As soon as the dressing is in contact with the wound, the silver ions are safely delivered only to the wound itself, not affecting the peri-wound skin. This means that you don't necessarily need to cut the dressing to the shape of the wound, which is going to save you time. But in only 30 minutes after application, UrgoClean Ag starts working against the infection, achieving a 99.99% efficacy in just 24 hours. So UrgoClean Ag is fast and it effectively reduces the signs of local infection and restores the healing process. Let's have a look at a little video of how the silver ions work in destroying the microbes. There you go. So let's not forget how important pain-free dressing changing is as well. UrgoClean Ag, when it comes to the unique TLC Ag technology that we've got, allows really atraumatic dressing changes. because the pain-free dressing changes are so important. On the picture, you can see a patient with varicose eczema. And on the right-hand side, you can see the patient's leg after the UrgoClean Ag has been removed. And that very delicate skin, which is so easily becomes damaged and bleeding, has been protected with UrgoClean Ag. And that's not the case with all dressings. On the left-hand side, you can see a polyamide fiber dressing. That's a contact layer coated with elemental silver. And that's, even though it's classed as an atraumatic dressing, you can see how damaged the skin has become underneath it. So with UrgoClean Ag, you get no pain at dressing changes. It won't damage newly formed tissue. It has complete non-adherence to the wound bed because of the unique TLC Ag contact layer. And it protects the surrounding skin as well. And that's really going to help your patients not fear dressing changes and be really good for their state of mind as well. Let's just spend a few minutes looking at the proven clinical evidence for UrgoClean Ag and what it means to you in real life. Here you can see what we call the evidence pyramid. As we've been through how UrgoClean Ag works, we've been provided evidence from a range of sources to show its efficacy. And this slide shows the sheer volume of evidence from randomized controlled trials to real life observational studies. And they're listed all down the right-hand side and at the bottom as well. So a huge body of evidence. But having looked at some of the clinical trials, let's now look at the real world evidence. And that means the experience of real clinicians and nurses like yourselves. Urgo have produced the largest real life observational study of any silver dressing on the market. And it's done over 2,270 patients. That's a huge number of patients. And what this study showed was, first of all, there was a real variety in the age of the patients. In fact, 77% of the patients, 77 rather, of the patients were under the age of 18. So not just elderly, but young people as well. The observational study showed that after 2 weeks, 90.6% of the wounds treated demonstrated an improvement in the healing process. The high antimicrobial efficacy and good restoration of the healing process occurred and this is crucial, regardless of the level of slough and exudate in the wound. In other words, UrgoClean Ag is highly successful when used on sloughy wounds and wounds that are highly exuding. UrgoClean Ag was found to be effective on all types of infected wounds and those at risk of infection. And as reported by clinicians, UrgoClean Ag demonstrated better performance and efficacy compared to a silver containing a CMC dressing. Here you can see the reduction in exudate from using UrgoClean Ag in both acute and chronic wounds. So again, this is from that real life evidence. And you can see that the percentage of chronic wounds at week 0 that had high levels of exudate was 54%. But when using UrgoClean Ag, this was dramatically reduced to just 16% by week 3. And on the right-hand side, you can see that when using UrgoClean Ag, acute wounds producing high or moderate levels of exudate fell from 50% at week 0 down to just 3% by week 3. So UrgoClean Ag effectively reduces level of exudate in line with the reduction of clinical signs of infection. And similarly, we can see from this chart a reduction in local signs of infection by week 3. The proportion of diagnosed infected wounds at week 0 on chronic wounds was 15%. And after using UrgoClean Ag, that went right down to 4% by week 2 and 3% by week 3, a real reduction. And with acute wounds, 15% showed signs of infection at week 0, and by week 3, none of them did. And that's just patients with visible signs of local infection. There may have been plenty more that were at risk of infection, in other words, that had high levels of slough or exudate. So UrgoClean Ag demonstrates effectively a significant reduction in the number of diagnosed infected wounds after only 2 weeks. So when we're looking at an antimicrobial dressing, what sort of things are important to you as well? Well, when looking at the real life observational study, there are 3 categories that we can sort of look at. First of all, those that are important to fighting the infection. Secondly, those that are important to the patient themselves. And thirdly, those that are important to integrating standards of care. And in this chart, you can see the percentage of nurses who found UrgoClean Ag performed better than the silver containing the CMC dressing. Everything from its antimicrobial efficacy and its de-sloughing properties, that's in terms of fighting the infection, it was superior, 83% and 85%. In terms of patient comfort, 69% of nurses found UrgoClean Ag better in helping the patient's pain, and 67% found it more acceptable to the patient. And in terms of incorporating it into your standard of care, 70% found it easier to apply, 69% found it more conformable, and 68% of nurses found UrgoClean Ag easier to handle. So in all these different criteria, whether it's treating the infection, being kind to the patient, or incorporating it into your standard of care, UrgoClean Ag was shown to be superior in that large observational study compared to the gelling CMC dressing. So let's now spend a few minutes looking at different types of wounds, different case studies that you as nurses may be challenged with, and that UrgoClean Ag can be used to effectively treat. Let's have a look at this leg ulcer to start with. So here you can see at day 0, a leg ulcer, a venous leg ulcer with a really unhealthy looking wound bed. There's a good deal of slough there. There's quite a lot of erythema going out from the wound. And the wound edges are also not looking very healthy. They're quite bright red and rolled, if you like. So to achieve a much more healthy looking wound with much more healthy looking skin on the outside, you can see there's much less erythema here, and actually the wound edges look better as well. I wonder how long you'd expect a silver dressing to take to achieve that result. So with UrgoClean Ag, this was achieved in just 1 day. So in 1 day, that wound's gone from looking quite angry, to be honest, with the erythema and the bright red edges, to the skin looking much, much better after just 1 day. And to achieve a nice, healthy looking clean wound bed with no erythema, nice wound edges, I wonder how long you'd expect that to take with the silver dressing. With UrgoClean Ag, this was achieved in 2 weeks. So that's a great result and what you'd expect. Let's have a look at another leg ulcer. Here we've got a venous leg ulcer with pretty much 100% slough in the wound bed. Again, not very healthy wound edges. You can see some erythema there. The slough looks quite thick. To achieve a wound bed that's really now quite clean and ready for granulating, and actually the surrounding skin looks better as well, I wonder how long you would expect that to take with a silver dressing. Again, by 14 days, UrgoClean Ag had really prepared this wound bed nicely. It's gone from having thick slough to pretty much no slough at all, and the surrounding skin has been nicely cared for. So quite a healthy looking surrounding skin as well. Let's have a look at a diabetic foot ulcer. So diabetic foot ulcer, as we all know, are really, really challenging wounds to treat. Very, very difficult to heal. Here you can see a diabetic foot ulcer between toes, so a very curved area, difficult to dress. When treated with UrgoClean Ag, the wound bed was cleared up nicely, and you can see that epithelial tissue coming in, and the size of the wound has shrunk. This was achieved in 14 days as well. And for a diabetic foot ulcer, this is an excellent result because they are amongst the most difficult wounds to treat because of the pathophysiology. So That's an excellent result. Another diabetic foot ulcer on a partially amputated foot, very, very sloughy, 90% slough, and very, very thick slough as well. To be nicely cleaned up, maximizing the chances of healing. Again, this was achieved in 7 days with UrgoClean Ag, which frankly for a diabetic foot ulcer is an excellent result as well. Let's have a look at a trauma wound. Here you can see a 90 or 95% sloughy wound, lots of erythema going on around the area. And to achieve a nicely cleaned up wound bed, okay, you've still got about 10 or 20% slough there, but you can see on the left-hand side, the erythema has reduced, and by and large, it's now prepared for granulation. This was achieved in just 3 days with UrgoClean Ag, so very, very quick cleaning up of the wound and reducing in signs of local infection. There we go. So to achieve the wound 95% granulated, ready for epithelialization, you can see the edges of the wound are now really healthy. There's very little erythema on the surrounding skin. This was achieved again in 2 weeks with UrgoClean Ag. And let's have another look at a different type of acute wound. Here's a burn wound on a child. So very, very challenging area to dress because of all the movement in the fingers and the curves as well. I wonder how long you'd expect that child's hand after a burn, it's a scald, to be fully epithelialized. This was achieved after 1 dressing change in 6 days with UrgoClean Ag. So the UrgoClean Ag was really conformable on this child's hand, kept in place with a retaining bandage, and that's an excellent result for a very challenging area. So UrgoClean Ag is really easy to integrate into your infection management practice. It comes in 3 different sizes. You can cut it if you want to. Now, we said earlier you don't necessarily need to cut it because it's safe on the surrounding skin, but if you want to use it in a cavity, you can cut it into a spiral and put it into a cavity. It's very, very atraumatic, as we said, on removal. Nothing is more atraumatic because of the unique TLC Ag complex. And you can use it under compression as well if you need to. So before I go, I want to remind you of the key messages with UrgoClean Ag to get your patients back to healing. First of all, it's simple. It's a really simple dressing, and it can be kept in place for up to 7 days. It's very, very safe because of our, as I said, our unique TLC Ag contact layer. It's really, really pain-free on dressing changes, really atraumatic, and it's effective. We've looked at all the evidence and it's effective at reducing local signs of infection, and it minimizes infection recurrence by a complete and continuous cleaning action in the removal of slough, exudate, biofilms, and debris from the wound bed. So we've looked at a lot of case studies there. How confident are you that you can use UrgoClean Ag and get your patients back to healing? Are there patients that you've got that you've maybe struggled with in preparing their wound beds because of slough, debris, and infection? Who do you think, what patients have you got that are similar to the ones that we looked at that would really benefit from UrgoClean Ag? Have a think about that. For more information on anything we've looked at today, please go to our website at the address you can see below, or contact your local Urgo Medical product specialist. Thank you so much for listening, and I'm going to hand back now to Sam, I think.
Brilliant. Thank you, Ben. Really, really interesting presentation. So thank you for that. And thank you, everyone, for watching and getting involved with the questions coming in. I saw a number of very good questions coming in. So please do keep sending them in, and we'll get through as many as possible now in the live Q&A. those links should be in the comments section as well. So it's I'll say this again at the end of the session, but it's urgostartplus.co.uk/contact-us. Those links will all be in the comments section as well. So we'll move on to the first question then, and this one comes from Anchor. Thank you, Anchor. Her question is, how often do we need to change it?
That is a great question. So, like I said, Anchor, the UrgoClean Ag can be left in place for up to 7 days. So that's a maximum of 7 days. Now, it may be the case that you can leave it in place for 7 days. It may be that you'd have to change it more frequently than that. It depends on how it's striking through the dressing. So if you're finding that you've got an infected wound or a sloughy wound, you put UrgoClean Ag on and it's striking through the dressing after 3 days, you may decide to change that. But if there's no strike through, it may be best to leave it up to 7 days. It's a little bit dependent upon your clinical judgment as to whether it's striking through or not, but you may need to change it more often. But don't forget that levels of exudate will come down as a wound becomes cleaner and less infected, because high levels of exudate are in part or can be due to a wound infection. So it may be that the level of exudate will be coming down slowly. So it may change from week to week, is what I'm saying, from the first week to the second week. Does that answer your question, Anchor?
Yeah, I think that answers it very well. I think we've got a couple of similar questions to that, so you may have covered all of that in that answer, actually. But we'll move on to question 2 from Ramona. Has mechanical debridement or oral antibiotics been used prior to dressing application to enhance the efficacy of UrgoClean Ag for infected wounds?
So what we'd advise, Ramona, is if you've got a locally infected wound that's not spreading, we advise that you use a topical antimicrobial, UrgoClean Ag. If the infection is spreading and it's, the erythema, the redness around the wound is spreading more than a couple of centimeters and it's getting worse, you would want to use UrgoClean Ag as well as a topical antimicrobial. And certainly if a patient has if they've got a systemic infection as well as a local wound infection, if they're ill, if they've got a temperature, they're feeling unwell, and all those signs of their whole body being ill, you'd certainly want to use systemic antibiotics as well as a topical antimicrobial. But if it's just a locally infected wound and that erythema around the wound is not more than a couple of centimeters, you would be fine just using UrgoClean Ag. Did that cover the criteria, Sam? I can't remember the full extent of the question.
Yeah, no, I think that answers it very well. Thank you. So question 3, I think this one you answered in question 1, but I will ask this question: how long can you leave UrgoClean Ag on for?
Mm-hmm. Yeah, so 7 days. It's as I said before, it may be that you can leave it completely untouched for 7 days, and maybe that's a good thing. If there's no strike through, very often it's best to leave it alone. The only time you'd want to change that is, of course, if it is striking through, because any dressing that has strike through, you'd want to change because it's a source of the bacteria, therefore getting in. But a maximum of 7 days, like we said in the first question.
Brilliant. So question 4 from D: would you continue with the UrgoClean Ag beyond 14 days in those leg ulcers that had improved?
Yeah, that's a great question, D. We advise that UrgoClean Ag will often have done its job in 14 days. It's not to say you can't use that after 14 days. What it means is you need to reassess the wound at 14 days. So after the 2 weeks, if the signs of local infection and the signs of the wound being at risk of infection, i.e. lots of slough, have gone, then you can stop using UrgoClean Ag. If for whatever reason there are still signs of local infection or still signs that the wound is at risk of infection, then you might want to carry on using it. But you're assessing it and you're justifying your continued use for it. and you document that. It may be that now you've got rid of the signs of infection and the slough, that you've prepared the wound bed, and you'd want to move on to something like UrgoStart Plus or something to speed up that healing, particularly on wounds that are vulnerable, like leg ulcers or diabetic foot ulcers. So you may want to move on to UrgoStart Plus or the UrgoStart range. But as long as you can justify whatever you're doing, you'd be fine, if necessary, to carry on with UrgoClean Ag or move on to something else. I hope that's okay,
Yeah.
Dee and Sam.
Brilliant, thank you. It leads quite nicely on to question 5, actually. So question 5 is, what dressing would you recommend using once the wound is no longer infected?
Yeah, so that's a good question. And you've got to look at the type of patient they are. So if you've got a patient who is elderly, so their skin's not going to heal as well under the best, in the best of times. They're diabetic, maybe they've got other chronic diseases. They have poor physiology because of the diabetes. You'd probably want to use something like UrgoStart afterwards, because they're at risk of the wound regressing again, because they're not young and fit. Their wounds aren't going to heal nicely. So you might want to use UrgoStart, because that, there are a lot of the caseload of the people we're looking at do have chronic diseases. They might not have the best lifestyle. They might not eat a great diet. They might not be very mobile, as well as the elderly side of things. So you're going to really speed up the healing with the UrgoStart range. I hope that answers that question.
Yeah, brilliant.
Sam.
Yeah. Yes, so I think we've got time for a couple more questions. Question 6: what makes UrgoClean Ag different from other silver dressings?
Yeah, that's a good question, and it really comes down to the cleaning side of things. So UrgoClean Ag is the only silver dressing that is able to clean the wound bed and prepare it for wound healing, because it's got the unique polyabsorbent fibers, and it will de-slough the wound. It'll get rid of the biofilm, it'll get rid of the debris, and it'll get rid of the microbes. So it's really the cleaning side of things with those unique polyabsorbent fibers.
Brilliant, thank you. So on to the last question, question number 7. Can I use a secondary dressing with UrgoClean Ag?
Yeah, you absolutely can. If you need to, you can put a super absorber on the back. Absolutely, you can. Don't forget, though, like we said earlier, high levels of exudate are often due to an infection. So when the UrgoClean Ag is doing its job, you should see over time that high level of exudate coming down. So it may be after a few days or into the second week, you won't need to use a secondary dressing. But absolutely, towards the start, there's no reason why you can't use a secondary dressing on top.
Brilliant. Well, thank you very much. Thank you, Ben, for that really interesting presentation and answering all those questions as well. Some great insights there. Thank you, everyone, for submitting your questions. If we haven't got through to yours, we will try and answer those over the next couple of days. We'll post those along with the slides from today's event and the video on our website. The link for that will be in the comment section. The call to action again, remember to request any more information from Urgo Medical. That's at urgostartplus.co.uk/contact-us. Again, that link will be in the comment section. The certificate link should also now be in the comment section too, so you can download that for your CPD and revalidation portfolio. And like I said, do visit the website. Make sure you follow us on Facebook so you don't miss any future events as well. That's all from us. Thank you again to Ben. Thank you, Urgo, and thank you to all our team in the background and Mold Digital. And finally, thank you all for joining us this afternoon. We do really appreciate it, and we will see you for the next one. Thank you.
Thank you.